Okay, now let us discuss about uh, conditions of facing someone who has loss of consciousness or in coma. This video, this brief video on loss of consciousness and the coma may help individuals who are able to help other individuals. It may help paramedical students as well as junior physicians and as well as early years of medical students. So, what do you do if you find a, a person with loss of consciousness or a person with coma? So, first of all, in a person with loss of consciousness, you have to think about the patient's vitals and conditions. First, first try to ensure your safety. Your safety is first. If your environmental safety is normal with no any threat to your life, then try to check the patient's vital signs. As the term tells you, vital signs are vital. They tells you the vital functions of the patient. Then on vital signs, you may find a clue. If there is no one accompanying the person, if there is no any friend, if there is no any family, and the patient is somewhere in the road, or individuals may bring the person just accidentally find him on the road and may bring to the health facility in the hospital or in the clinics or in a health center. Then the first thing that you have to check is the vital signs. The vital signs tells you a lot of information. A lot of information can be derived from the vital signs. One of the most important vital signs is blood pressure of the patient. For example, if the patient's blood pressure is significantly elevated, then you have to think of like cerebrovascular accident or stroke or hypertensive encephalopathy. Hypertensive encephalopathy. So, if the patient's blood pressure is significantly elevated, then you have to think this either hypertensive encephalopathy or cerebrovascular accident or what we call stroke. Then if the patient's blood pressure is low or hypotensive? If the patient's blood pressure is low or hypotensive, then you have to think of about conditions that may cause hypotension like sepsis that may occur due to infectious conditions, especially infections due to gram negatives are common to cause hypotension. Other conditions that may present with hypotension could be endocrine abnormalities like Addison's disease, like patients with thyroid myxedema or what we call myxedema coma. These conditions may present with hypotension or a condition of hypovolemia like heart failure could be also another cause for the patient's loss of consciousness. Then, what's the other vital sign is you have to check the pulse rate of the patient. So, what the pulse rate tells you, if the patient is tachycardic, if the patient is tachycardic, a lot of conditions are associated with tachycardia. You may think of thyroid abnormalities, you may think of again infection that may cause tachycardia, and also you may think of if there is significant elevation in pulse rate, arrhythmias that may be associated with vascular abnormalities may also present with tachycardia. What if the patient is having uh, bradycardia or low the heart pulse rate? The pulse rate is below 60, then you call it bradycardia. What if the patient presents with bradycardia? You have to think of sometimes even infectious conditions may present with bradycardia. Other other problems. It could be heart failure. It could be electrolyte abnormalities, or it could be the previous one we mentioned, like endocrine abnormalities. Endocrine abnormalities may present with, like for example, patients with hypothyroidism may present with bradycardia. So the problem could be one of these differential causes. The other things, bradycardia may be also caused by impending brain herniation. Impending brain herniation, the bradycardia is one of the three triads of tells of signs of brain herniation, signs of brain herniation. So bradycardia, hypotension, and irregular respiration, these are the impending signs of cerebral herniation. So it could be one of the impending sign of brain herniation. So you have to think of these things if there is bradycardia. If there is low oxygen saturation, then you have to think of either respiratory failure, or the problem could be in the center of the respiratory center could be the problem, or it could be obstructed in the respiratory system. So you have to check the breathing system or the respiratory system should be checked if there is uh, low respiratory rate. If the respiratory rate is high, then we have a lot of differentials as well. So initially, before you go to any investigation or history taking, you have to check the vital signs appropriately. And usually in emergency, things you do is simultaneously, which means you have to take history, physical examination, and the management of the patient should go in line with parallel. In line parallel, you should go on these things together. After you stabilize the patient's condition, then you can go for other deep history taking and as well for the advanced investigations. You can do these things later. Initially, stabilizing the patient's vital sign is far more important than thinking other advanced things. Metabolic conditions. For example, you can take hypoglycemia. Hypoglycemia may kill the patient within a minute. So before you do anything, you have to check the uh, blood sugar level of the patient. The blood sugar level of the patient. Probably the cause of the coma could be hypoglycemia, or the cause of the coma could be due to HHS or the diabetic patients may develop HHS, or it could be decay. The cause of the coma could be decay, it could be HHS. So initially you have to check the blood sugar level of the patient. That is vital. Always for coma patient, you should think the blood sugar level, random blood sugar level should be equally taken as like a vital sign. You should think it as a vital sign for coma patients. So these are important initial steps for patients with coma. Uh, Next, I may bring you other important videos and informations about how to approach a patient with coma or with the loss of consciousness. Thank you very much for looking this video. Please share it and subscribe if you like it. Thank you very much. I'm Dr. Abati.